Hi, I'm Dr. Shilpa. Today's topic for discussion is fibroid uterus. Fibroid uterus, I think, is a very common condition which many women will face in their lifetime. And fibroid uterus is something which is commonly discussed in many platforms. And this, I think, every woman needs to be aware as to what it is, because this is one of the commonest the tumor which is seen in the woman's body. So this fibroid is like an overgrowth of the cells of the uterus muscle, which we call it as myometrium. And these can be either symptomatic, or they could be without any symptoms, which will be there in their body for years together, and they can range from say like 0.5 to 1 centimeter till almost like 30-35 centimeters. So there is a wide range of say symptoms, wide range of locations where they could be located in, and they could cause a wide range of problems to the women, and the treatment is quite often very simple, straightforward surgery. So when we talk about fibroids, the most important thing as a clinician, as a doctor, that I would like to know is, one, what is the size of the fibroid? What is the location of the fibroid? Is it close to the uterine cavity? Is it far away from the uterine cavity? Is it very close to any of the structures like say bladder, ureter, or intestines? And is it causing pressure symptoms on the women, if at all, if it is causing say like problems in passing urine, passing motion? So all these things are very important. And also the age of the woman when these fibroids are diagnosed, because these are quite commonly seen between the age of say like 25 to 50 years of age. And the fibroids, I think the most important thing that we should know is that 50% of the fibroids are without any symptoms. And also the fibroids are so common that it could be there in women in 25% of the cases. So if I do a scan for 10 women, at least 2 of them will have a fibroid, though they may not be significant. And all fibroids definitely don't need treatment, which I think should be kept in mind. So many a times we come across patients who would have done a health checkup and who would have done a scan for something else, and they have discovered that they have a fibroid, and they come to us with that report to discuss whether any treatment is required or not. They are totally unaware of it. So these are the situations that we come across commonly when it comes to a fibroid uterus. So the chances of the fibroids turning into cancer is less than 0.5%, and I have definitely not seen it happening commonly in my practice. In the past 20 years, I have seen only 2 cases of uterine cancers in a fibroid. And also the size of the fibroid is not proportionate to the symptoms. The symptoms are more when the fibroid is closer to the uterus, when the fibroid causes fertility issues, and when the fibroid is kind of like causing heavy menstrual bleeding to the woman. So apart from these, about fibroids, if I have to tell, then it is a very slow growing tumor. It grows about say 0.5 to 1 to 2 centimeters per year, and having a track or being under a follow-up of a gynecologist if you have a fibroid is extremely important, if you have not been having any symptoms and if it doesn't require any treatment. And there are very simple ways to diagnose a fibroid, which just takes one ultrasound scanning through the abdomen or through the vagina, which can diagnose the fibroid. So usually the treatment of choice for fibroids is either laparoscopic removal of the fibroid, which we call it as laparoscopic myomectomy, which is done as a keyhole procedure, or it could be done through an open incision and the fibroid can be removed. Or if the family is complete and if there are too many fibroids which cannot be removed, and if they are too big, then the option of removing the uterus also can be considered. So this is about fibroid. There is no need to worry if you have a fibroid. There are quite a few suggestions which I can make as to how to deal with it. And thank you for watching this. Have a great day.